Substance abuse. The rise in the abuse of substance by young adults and teenagers is one of the major issues that is plaguing our country today, other than rising dollar. Young guys smoke shisha, India hemp, colos, just about anything to get them high. Remember the popular raise and, okay, that's the terminology cutting from smoking. Welcome to the health show. Remember to like, subscribe, and share this video. By definition, substance abuse is the excessive use of psychoactive substances such as alcohol, pain medication, and other illegal drugs. Now, drugs that are primarily associated with abuse include amphetamine, barbiturates, cannabis, cocaine, hallucinogen, and opiates. Don't worry, I'll break all of those down, okay? Among all of these, shisha, being the most accepted drug, constitutes a high dose of polycyclic aromatic hydrocarbons, which is a known cancer-causing agent. Now, the shisha craze in Nigeria is no joke, especially among young people. I mean, teenagers are diving headfirst into this addiction. To clear this up, shisha is a water pipe for smoking tobacco. They call it hookah. Shocking, right? Now, shisha, like cigarettes, is filled with nicotine tar, carbon monoxide, arsenic, lead, and other nasty chemicals. And yet, it is not just a youth thing. Like celebrities, role models are joining the shisha craze. Okay, they are posting pictures online, making it trending, and everyone wants a piece of the action. Now, while the rich are getting high on their expensive shisha, poor kids, especially those in the north, are getting high on lizard piss. You got it right, lizard dung. For instance, when mixed with clothing dye powder and a popular medicinal herb, lizard droppings offer an unimaginable high to those that are addicted to it. Now, I know you want me to tell you how it is prepared. I will not. Forget it, I will say it. Now, take a bowl, add a blue dye powder to some water, then take the seeds from this fruit called zangami. Okay, it's a powerful medicine. Next, you take the white part of the lizard dung. I wish you luck as you look for that. Now, crumble it into water, then drink. Now, drink it after watching this video, not now, okay? Now, the white part of lizard dung is called urate. Now, it is the lizard equivalent of urine. Like, they have a very efficient kidney that extracts the water from the urine and leave that pasty white solid behind. Now, the white tips are crystal-like uric acid, that's why it's high. Makes people get high rather. Now, let's move on. Another popular drug that is abused is marijuana. Unlike what is currently known for, marijuana was grown initially because of its herbal effect. Marijuana is a herb that can be planted anywhere. Almost all parts of marijuana can be used for psychoactive purposes. Just the leaves, the stems, the seeds. So how does marijuana make one high? Marijuana has a psychoactive wizard content called THC. Okay, I don't want to bore you with all the pharmacology, but that THC is just like food and drugs on steroids. Now, if you're into vaping or puffing on marijuana, THC, that is in marijuana, enters into your bloodstream and hits you with highness in the blink of an eye. It is a rapid joy explosion, okay, that peaks around 30 minutes. And after about 1 to 2 hours, your body is back to normal. Now, if you sip or eat or brace yourself for a marathon, okay, it will take hours for you to sober up, and this can hinder your decision-making process. Now, before we go, let's talk about how the brain forms an addiction with drugs. It is very important that you know that. So normally, our body secretes dopamine when we do activities we like, such as when we see that boy we are crushing on. Some of you, when you click on a video, or you want to eat your favorite meal, like this and those that I've warned you not to eat. But for psychoactive drugs, right, the dopamine secretion is multiplied, and this makes it hit a whole new level of highness. But when you stop, there is a deficit. Your body no longer feels good when these little excitements come up like before. Your food and your loved ones no longer excite you simply because dopamine that these things secrete are not as much as the ones that the drug initially has secreted. Then your body begins to crave for that substance that gave you that highness. Alright? Fast forward to when the drug magic fades away. You are left with a dopamine deficit. And it's not pretty. You are at your lowest, feeling as if the world is crashing on you. You might even try to toughen it out, but it's a battle. Now, the strength to soldier through starts to reduce, and you are stuck in a gloomy feeling. That is when the drug comes into play again. But this time, it is not for pleasure. You are taking it to feel okay, to be physically stable, well, normal. And that, my friend, is called addiction. Now, there are several ways to stop addiction and smoking. Now, there is also the cold turkey method. Now, this involves your will. You're giving up smoking, giving up vaping, okay, with your will, with no outside help. Now, people who use this method rely on their willpower, and they go through their cravings and withdrawal symptoms by themselves. But the truth is that it is harsh and it is cruel, okay? Sometimes you want to seek professional help. This is very profound because counseling is actually one of the ways it helps, like one of the ways to stop smoking, all right? You can also go for rehabilitation, although I can barely count rehabilitation centers in Benin. Now, there is more extended treatment, but that involves you visiting the hospital and then speaking to a doctor, asking for help. All the antidotes for whatever drugs you are addicted to will be administered to you. So that's it for our show today. Please stay away from shisha, marijuana, and all sorts of hard drugs. Thank you for staying tuned to the end. Remember to share, like, and subscribe to this video. Tell us what drug people are using in your area. Alright? In the comment section. Good day now. Bye bye. There are a lot of half-truths and misleading information on ovulation and getting pregnant. Welcome to the Health Show, your number one health content provider. Now, trying to conceive or not conceive makes you available to all sorts of information and theories and advice from concerned family and friends. Ordinarily, information like that may sound reasonable. For instance, hanging on holding your leg up for some time after sex to enhance the movement of sperm to the fallopian tube, okay? And or taking extra lime or juice and grapes to prevent you from getting ovulation. Both advice make sense, but they are not accurate, okay? There are a lot of rumors out there. Meanwhile, healthy sperm cells are good swimmers regardless of the sex position. That's for my couples anyway. By definition, ovulation is when a woman's body releases an egg from the ovary, traveling through the tube toward the uterus just after a menstrual cycle. You must have heard that a woman's cycle is 28 days and ovulation is on the 14th day, which is the midpoint. That is the correct average. What is entirely wrong is assuming that every woman ovulates on the 14th day of the menstrual cycle. Ovulation may occur on day 14, as early as day 6, day 7, or as late as day 19 or 20, which is normal, and this depends majorly on the length of the woman's cycle and other factors that can affect ovulation and maybe cause stress. A woman with good fertility may have a cycle as short as 21 days or as long as 35 days. Knowing the length of your menstrual cycle is very important in determining your ovulation day. So what are the signs of ovulation? How do you know that you're ovulating? Well, it is pretty simple. Common signs of ovulation are changes in the cervical mucus, breast tenderness, a rise in basal body temperature, you're just feeling hot all of a sudden, and increased sex drive. Now, pelvic pain is also one of the common symptoms of ovulation. Why some women are complaining about their occasional pelvic pain that they feel during ovulation, other women are seriously battling infertility. Now, there's a direct relationship between ovulation and fertility. If there's a problem during ovulation, it can lead to infertility. Now, some of these problems are irregular periods. If your period is too long, too short, irregular, or you don't experience periods at all, there is a high tendency for you to have fertility issues. By the way, there have been a lot of misconceptions about fertility. One particular and one popular one is linking cough medicines to fertility. Now, the rumor says that taking a lot of cough syrup will help improve fertility. Sadly, it can't. Now, the idea behind this misconception is that cough expectorants, which thin mucus, could enhance fertility by addressing the cervical mucus thickness. However, taking these expectorants has not proven to reduce cervical mucus thickness, so it therefore has no relationship. Now, infertility is often more complicated than just cervical mucus concerns. Another common myth flying around in Nigeria today is that your lifestyle cannot have any effect on your fertility. Now, this is false. Lifestyle habits like obesity, alcohol consumption, and smoking can hasten the release of a woman's egg and increase the risk of ectopic pregnancy. Now, for instance, women undergoing fertility treatments often quit smoking as it can hinder positive outcomes. Now, even if you eventually get pregnant after conception, smoking raises the risk of miscarriage, particularly for women who become pregnant through in vitro fertilization. In the later stages of pregnancy, smoking can lead to congenital disabilities, growth restrictions, and high maternity blood pressure. Now, when aiming to quit smoking, consider a gradual approach instead of an all or none mindset. Even reducing the number of cigarettes can positively affect fertility and bring health benefits. All right. Now, you need to know that there is no level of cigarette smoking that has been deemed safe during pregnancy or ovulation. So you have to quit all of that. Now, figuring out how to tackle infertility is like a puzzle, and it depends on several factors rather than just one. Now, there's also the aspect of fertility window. These are the magical days in a woman's cycle when baby making is on the table. Now, this window isn't one size fits all. It dances and beats around for different women because of their different cycle. Sometimes the cause of infertility can't be traced. If about 3 years of trying doesn't lead to pregnancy, there are treatments like assisted reproductive technology. Now, you need to know that going into treatment involves some severe commitments, financially, physically, emotionally, and time-wise. Every woman's fertility journey is unique. Some find success with just a treatment or two, while others might need a mix of therapies to get that positive result. Now, if you're having difficulty ovulating, talk to a gynecologist and he'll be able to talk you through on how to calculate your ovulation period and be able to address whatever is stopping you from getting your ovulation. Thank you for watching. Remember to subscribe, like. I really hope you learned something from this video. Bye for now.